All right. Hello. Happy Friday from me and Amy Nyer today. So excited. This is the second time we've gotten to do this together. And if it were really up to me, we'd probably do this every week because it's much more fun. But I am Julie, the owner of Re+active Physical Therapy and Wellness. We have 2 places in the Los Angeles area, and we really focus on working with people with neurologic disorders, and many people with rare disease fit in this category. And actually last night we had one of our mini courses, and I was thinking about this because we're doing this for Rare Disease Day, and we were looking at movement analysis for movement disorders. And the main reason that we're talking about that is because there's so many rare ones that are difficult to characterize and difficult to put words around. So anyway, side note, our mini course was really fun on movement analysis, and it really ties into some of these rare disorders. We have a particular passion for rare disorders, which is why I love having Amy on our team, because that's her passion as well. And tomorrow, is that right? Tomorrow, because it's the 29th, it's a leap year, it's a rare day.
It is.
So it's Global Rare Disease Day. And, you know, we happen to see not only neurologic rare diseases here, but kind of the whole spectrum. And we've experienced as therapists and as people some of the challenges that come with that, and probably no one more personally and professionally than Dr. Nyer. So honestly, I didn't know about Rare Disease Day until you told me about it. So can you talk about it a little bit, and maybe about like the irony of how common rare diseases are?
Yeah, so you know, tomorrow being Rare Disease Day, it often is on February 28th, but this year we get to celebrate it on a leap year. And it's a way for people with rare diseases to be able to get the word out there that there are, I think, as many as 7,000 rare diseases identified, and an estimated 25 to 30 million people in the USA are living with rare disease. So there are so many different types of rare diseases that affect so many people, but to become a rare disease in the United States, it's defined as a condition that affects less than 200,000 people. And so what you have is a lack of understanding in the medical field about these conditions. There's so many of them, so how could you possibly know them all? A lack of research, a lack of medicine, and really a lot of people who are needing hope and needing help.
Mm-hmm. And I'm so glad you said that word hope, because that was that's kind of a theme for Re+active in general. Part of that hope comes with just understanding some of those challenges in rare disease, and I know we see them a lot in the different cases that we see every day here. So for people maybe that don't see a lot of rare diseases, or maybe they're starting to see some, or maybe even have one, like what are some of those common challenges that people face?
Yeah, so when people have a rare disease, I think probably one of the #1 concerns for them is that they have this feeling of isolation, this feeling of not being well understood, particularly with rare diseases with invisible symptoms. So they feel really bad, but they look just fine on the outside. And to get their friends and family and then their healthcare providers to take their condition seriously can be very isolating. They also often have difficulty creating that healthcare team. They may have difficulty finding providers who understand just the basic concepts of their condition. What are the symptoms of their condition? How do they present? And if the providers have never heard of it, that would be really difficult to lead that health journey. Also, sometimes we might even get providers who are dismissive of the condition or of the symptoms, or who may say, oh, you have these symptoms, you probably have this more common condition, even if it's already been ruled out. So it's really challenging for them to find those healthcare providers who are willing to sit in the unknown with them and walk the journey with them as they search for answers, and just really be comfortable with the uncomfortable. Some other issues that they may come across. So when you have a bunch of symptoms that no one really knows what they mean, why they're coming on, you turn to the internet. And I'm saying this on the internet, so I understand. I myself have used the internet as a tool for so many things, research in grad school, personal research, and online, you get that sense of community and camaraderie. You have other people who have the same conditions or present similarly, so you feel all of a sudden you're not so alone. And then you can do your own research. You can learn and educate yourself and your healthcare providers. But the problem is these sources may not be reliable, and they may be completely inaccurate what they're telling you. So then how do you piece that together? How do you differentiate yourself? And then lastly, because a lot of these rare diseases are not well understood, the diagnostic criteria is very contradictory at times, conflicting or contradictory. So then let's say you have a healthcare professional who wants to help this person, but they don't even know which diagnostic criteria to follow, or they get a bunch of lab values and they don't even know what to make of it. So it could be a very long road to diagnosis, and then once they're diagnosed, they don't really even know what to do with that diagnosis.
Yeah, and we've definitely seen that in the people that we've worked with. And I think that feeling really isolated is probably one of the things that really rings true. I was just thinking of somebody that I met this week who had never met another person with that disorder. Yeah. And so when we were able to express that we've seen this before and we've worked with it, and we've also seen changes and improvements, that, one of those challenges being like a general lack of hope, like that really starts to change.
It does. And I think that's where the internet helps so much, because you just automatically have more hope because you see other people like you.
Mm-hmm. Yeah, exactly. And so what have you found that might be helpful for people to face some of these challenges or cope?
Other than the community and the support, I think really if people who have these conditions have a teamwork approach with their healthcare providers, it really helps guide their treatment and improve quality of life. I think something that's so difficult for people is when they're fighting with their healthcare team and trying to get their opinions known or the research that they found out there, and just a real good teamwork approach where everybody's on the same page, including the person with the rare condition. I also think that we need to help them find a way to improve quality of life, because when you're isolated and you're feeling sick and no one knows what's going on, it has such a huge impact on quality of life. So to focus management and treatment on improved quality of life, improved independence, regardless of what the condition is called. It's just really important to help improve their identities again.
Ooh, yeah. I think that's a big one, is regaining that identity and identity away from just a diagnosis and a medical condition. And this is probably one of the biggest areas where I think PT and OT can come into play. Certainly we're not giving the diagnosis and we're not running diagnostic tests, but boy, when it comes to quality of life and identity, absolutely. So I was wondering if you could talk a little bit about PT, even, I know you're not an OT, but because we have an amazing OT on our team, I think you can speak to that as well. How do we fit in that process?
Right. I think that PTs are, we're really well suited to fit in as part of the healthcare team for people with rare diseases, because we have the gift of time on our side. People come in with their rare diagnoses and they see us once a week, twice a week, maybe 3 times a week, and we see them week after week after week. So we have a lot of time to get to know them, to get to know their condition, to do research for them, and to help them problem solve. We also can help a lot with management, even if it's not your specialty. I think physical therapists and occupational therapists are great at dissecting data, and we can collect data and analyze it so well. And a couple conditions that come to mind, like Ehlers-Danlos syndrome, dysautonomia, mast cell activation syndrome, you have triggers, like any sort of trigger in the world can be barometric pressure changes or food you ate yesterday, stress. We can help our the people that are coming in with like teasing out what are their main triggers and how to manage that so that they have improved quality of life and they feel better. So it's really, I think, a lot having to do with how much time and how much face time we get with those people. And then I think that we can also, really help with that sense of hope and that direction. Again, you don't have to know every single rare disease and all the intricacies of every rare disease out there to be able to help somebody and to help kind of facilitate their team as well.
And I've definitely seen you do this, and many of on our team do this, really coordinate the care with the whole medical team and bring the right people on board. Oh, you need this specialty, here's a great referral. Oh, you need a psychologist, here's a great referral. And while the PT or OT is not the primary medical provider from a medicine standpoint, I see as like a quality of life and connector for people. An interpreter of all of that information on the internet too.
Yeah. It's true.
And I think that really it speaks to one of the things that like really led me to even start Re+active is to and to have a space kind of outside of the traditional medical world, like we're not based in a hospital or anything like that, is to provide a place of hope and direction and provide a place where we join people on a journey. And I find myself feeling very emotional about this because I feel like we're so lucky to have a team of people here who's so dedicated to that, that really have a great medical understanding. They really care to learn and know more so that when, before a couple of years ago, I had never even heard of mast cell activation syndrome.
Right.
And now I want to learn and know more. And that is one of the beautiful things I think about our team and about PTs in general, is that desire to learn and know more to help people with rare disorders. So I feel really lucky that we are able to be a source of hope and connection for people.
I do too. And I think at Re+active, being a neurologic physical therapy clinic and any other neuro PT clinic, we're even better suited at helping people manage their rare diseases, in particular because of just what we do and like how we problem solve. Like we're looking already at like brain fog, how that's affecting cognition, how that's affecting dual task abilities. We're looking at exercise intolerance, reduced functional mobility, poor movement strategies, poorly integrated sensory systems, and impairments of dynamic balance, and that's just a few. So I think like beyond the helping guide the team, like we actually do have a lot of skills as neuroclinicians to be able to affect the quality of life for many different rare diseases. And so I don't know if PTs are watching or people who have conditions are watching, but I think that if you are a PT, I urge you to take in people with rare diseases with that excitement that you would with conditions that you know really well, because I guarantee you can be such a key member of their team. And if you are a person with a rare disease or you're suspecting, take a look and see who around you beyond your go-to healthcare providers, like who else can be part of that team that can help guide you and be an advocate for you.
Yeah, absolutely. And I'm going to offer up Amy as a resource. So like if you are, if you, for example, are working with people with Ehlers-Danlos, mast cell activation, dysautonomia, things that are rare and you don't have experience, like shoot us an email. This is something we're really passionate about, connecting patients with the providers and with the information needed. And I know you mentioned a couple of resources to me that you've shared with me, and I know we'll put the links in there. One of them was the NORD.
Rarediseases.org. Yeah. And they're the group behind Global Rare Disease Day. So I highly recommend checking out their website. They have so much going on. I know many people right now who are in DC advocating for different rare diseases, and hopefully one day I'd be able to join. That'd be really fantastic. But there are a lot of boots on the ground advocating for a lot of people and a lot of conditions. So check that out. And also through NIH's website, they have, I think it's GARD, G-A-R-D, but it's more information on rare diseases. And particularly that's where the database of all the rare diseases can be found.
Awesome. Thank you so much. So I'll put those links in here. Thank you all for joining us as we're celebrating the day. It is actually tomorrow. We're celebrating a day early. And for really advocating for people with rare diseases. And we will catch you next week.
Thank you.
Thank you, Amy.